namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And do appreciate you tuning into our podcasts regularly. And of course, you can always go to hotzepodcast.com. That's HOTZE podcast.com. And you can download all of our podcast programs. Well, today, what do we have on tap? We have the topic of hysterectomy, which of course affects a lot of women. They make a decision to get a hysterectomy and maybe they feel like that was the best course for them. However, there are certain side effects that come from that and certain consequences. And one of them happens to be low libido. And this is a topic we get quite a bit. So Dr. Hotze, why don't you speak to our audience today about how that affects women and what can they do after they've had that hysterectomy?
That's a great question. And thank you, Stacey. Thank each one of you for joining us here on the Wellness Revolution. Remember, I believe that you need a health coach. You need a doctor and a staff of professionals that can coach you on a path to health and wellness naturally so as you mature, you enjoy a good quality of life. Hysterectomy, big problem in America, and it's a surgical procedure which, of course, removes the uterus. A total hysterectomy simply removes the uterus. Most lay people think that means it takes the ovaries out too. They either had a partial or a total hysterectomy. Total hysterectomy means removal of the uterus. Hyster is uterus, and ectomy is removal of. The removal of the ovaries is the bilateral salpingo-oophorectomy. In oophorectomy, the ovaries, or in a medical term in Latin, would be oophorectomy. So in medical terms, we call it a TAHBSO, total abdominal hysterectomy, bilateral salpingo-oophorectomy.
Oh my goodness, that's a tongue twister.
That's a lot to say. So when a woman has her ovaries removed during a hysterectomy, that's going to obviously adversely affect her hormones because you're removing the organ, the ovaries, which produce her natural hormones. And the fact that she had a hysterectomy tells you that she had hormonal imbalance to begin with. So a hysterectomy is normally performed by physicians when a woman has heavy periods that are prolonged and protracted and involve clotting, and they have breakthrough bleeding and severe cramping, and doctor checks them, and they also have fibroids, and these are all medical indications, surgical indications that OB-GYNs use to justify doing a hysterectomy. The real question is, why in the world did these problems occur? Why don't they occur in all women? Why don't all women have problems that have a hysterectomy? Why is it just a certain percentage of women? Well, it's because not every woman's hormones become as severely imbalanced as others. And when a woman has heavy periods and the development of fibroids and breakthrough bleeding as she marches through her menstrual life, that's an indication that she has had a decline in her progesterone, which is the hormone that is produced at the time a woman ovulates mid-cycle, day 14, 15. So that balances out the estrogen. So in order for a woman to be hormonally balanced, she has to have adequate amounts of estrogen produced with adequate amounts of balancing progesterone. It just so happens during ovulation, a woman also makes a little testosterone, which you'd think of as the male hormone, but it's also a hormone made by women in small amounts. And at that time, it's interesting the way God organized it. It happens when a woman ovulates. Well, the egg after a woman ovulates only lives for 1 day. It can only be impregnated 1 day, and it's that same day that testosterone is released, which all of a sudden makes a less than handsome-looking man look awful attractive to a young woman, because that's one of the effects that testosterone have. You might call it the love hormone, the hormone of desire. And, of course, we know what it does in boys and teenagers. It makes them crazy. It makes men crazy. But women have a little of that, and it makes her husband spouse much more interesting for a period of time when he may not be other periods of time. So that was in order to make sure that we did reproduce the species, I think. Of course, and animals are the same way. So anyway, but after a woman has a hysterectomy, leading up to, before she has a hysterectomy, she's going to have low romantic moods and inclinations. Her hormones are going to be imbalanced. She's going to have low thyroid as a result of hormonal imbalance. She won't be getting adequate amounts of thyroid hormone into her cells because she's got estrogen dominance, which leads to thyroid imbalance and decline within the cells. So her energy level goes down. She has difficulty with weight, can't think clearly, mood swings, headaches. She can't sleep well. She gets joint muscle aches and pain. She doesn't feel well. And maybe she's got irritable bowel syndrome or constipation, recurrent infections, and she's not. Her hair's falling out. And she feels frumpy. She doesn't feel good. And the last thing she's interested in is having any romantic desires. As a matter of fact,
kind of gets to the bottom of the list.
As a matter of fact, I had one lady show me one time here in the office. She wore a T-shirt. I asked her, how are your romantic moods and inclinations? I'm trying to be a Southern gentleman, and very, very polite. And she said, well, I'll just tell you about that. And she pulled up her shirt. She had a T-shirt on it. It said, what part of no don't you understand? And that's what she said she wore to bed every night. So I got the message that her romantic moods and inclinations were not stellar. And then I don't think Papa was getting Happy Meals either. So that's what happens. And I've had, women tell me that as they march through their menstrual life. I just don't have the same desires I used to have. And that has to do with two things. The fact that they go through anovulatory cycles and don't ovulate every month after a woman hits 35 or 40. They have anovulatory cycles, and that's when a woman, if they have ovulatory cycles, they don't make any progesterone that month or give off any testosterone. So inevitably, and as progesterone also is very similar in function to testosterone, it also is it enhances romantic desires as well. So women whose progesterone levels have collapsed and they've got estrogen dominance and they have poor thyroid function, they're just not going to have romantic moods and inclinations.
Well, and certainly if you are feeling like you've got any of these symptoms, definitely give us a call at 281-698-8698. We can certainly help you with these symptoms that you've been experiencing. Well,
that's for sure. And all you have to do is balance your hormones. So I think most hysterectomies can be averted. And I can think of we have had 31,000 guests here since 1989, and now say 75% are females. I can count on one hand, the number of women I know that I have recommended to go ahead and get a hysterectomy, and I have fingers left over out of seeing, 25,000 females, many of whom, and most of whom are in that age group where they're still menstruating or going into approaching the change of life. So hysterectomies can be averted if you balance your hormones, and you should do that. And also, romantic moods and inclinations can be increased if you balance your hormones. That's very important. So progesterone, a little testosterone can go a long way, as well as thyroid can go a long way to helping a woman feel more full of vim and vigor and more, really, a woman will feel when her hormones are balanced, she just feels better and feels more attractive. Part of it is, romantic moods and inclinations are not only just governed by your hormones, but they're also governed by the way you think about yourself. And the hormones affect the way you think about yourself. And they also help you maintain a good energy production, good energy level, good metabolism, so you can maintain a good weight, which helps you feel better too. So those are some things that I want to inform you about that are associated with women who may have been recommended to have a hysterectomy or have had a hysterectomy. It's all about balancing your hormones so you'll feel the absolute best you possibly feel. And that's why I encourage everybody to do a 180. Most people are on the wrong side of the freeway, barreling down it, going over an overpass on the wrong side. They're going to hit, get crippled, get killed. You need to do a 180 and take charge of your health. And when should you do it? I think today's the first day of the rest of your life, so you might as well get on a path of health and wellness today.
You are listening to this podcast for a reason, and we just want to let you know that there is hope. Whether you are considering a hysterectomy or maybe you have had a hysterectomy, either way, there is good news, and we can certainly help you solve your issues. You can give us a call at 281-698-8698 for a complimentary health consultation. That's 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.